Hello, welcome to Midwife Dave. This is another one of my videos in the series about pregnancy, labour, birth and caring for the newborn. As you know, I'm Midwife Dave because they can't say my name, which is Piroshka. I'm a registered midwife here in the UK. So today's short video is something I've been asked a lot about, and that's about pre-eclampsia. This is something that comes up quite commonly in pregnancy, but it's surrounded by a lot of misinformation. And this condition, you know, people get very, very worried about. Now, it can be quite serious, but it's one of the best managed conditions in pregnancy in the UK. So, what is it? Pre-eclampsia is a condition that is thought to start from the implantation of the placenta. We haven't got a 100% reason why it happens. However, what happens is the placenta malfunctions. It doesn't supply enough blood to the developing fetus, and the fetus can become quite small in size. Now, the reason for this is because the mum's blood pressure rises in the pregnancy to a very high level, okay? And this, because the high rise in the blood pressure, it's all very technical, I'm going to keep it simple, this restricts the blood flow to the fetus via the placenta. Now, what are the symptoms for you as mummy? So, symptoms are high blood pressure that's raising significantly every time you go and see your midwife. If your blood pressure has risen, ask your midwife to check it on a manual blood pressure. It's called a SFIG, all right? Get her to check it on that, because sometimes the electronic blood pressure machines can get it really wrong. And if you have got blood pressure problems or you are getting pre-eclampsia, this condition, your blood pressure should be measured manually, okay? Technically, in pregnancy, it should be measured manually all the time, but there we go. All right, so you'll get a rise in your blood pressure. Now, this you won't know about until you actually have it checked. So what are you going to feel in the meantime? So you may feel generally unwell. You may have a headache. Now, this is a different sort of headache to what you've had before. This headache is mainly at the front. It doesn't move. Always when you get a headache, even in pregnancy, take some paracetamol, make sure you've drunk lots of water, particularly in the heat. Should be drinking at least 3 litres of water a day, okay? Now, normally in pregnancy, you know, take your paracetamol, your headache should go. If you're prone to migraines when you're not pregnant, just check, is this similar to a migraine that I would normally get? Same sort of symptoms. The headache you get with pre-eclampsia is frontal. It doesn't move, there's no respite from it, okay? You can take paracetamol, it doesn't move, there's no change, okay? The other thing that you get are what we call visual disturbances. Now, with this, you'll get lots of sparkly lights. It's not like occasionally, so you get those little black floaty dots, okay? This is very significant visual disturbances. You may become photosensitive, that means you're sensitive to light. However, again, if you have migraines, normally, check, you know, is this the same as I get with a migraine? Now, pre-eclampsia tends to be a combination of a lot of symptoms. So, as we've said, one is the headache. Secondly, you may find that you get sort of indigestion, pain, sort of an acid sort of pain, just under the rib cage, centrally there, above your stomach. And again, that doesn't go away. It becomes quite tender right there at the top of your tummy there. Not low down, okay? So it's right up in the centre near the ribs. All right. The other symptom that you will notice is swelling. Now, this is a tricky one because in pregnancy, you tend to swell up, especially in the heat. Your feet and your hands will swell up. So if you notice any swelling, pop your feet up, rest, okay, and see if it goes down. The difference between preeclamptic swelling and normal swelling in pregnancy is that the swelling doesn't tend to go down. It also tends to affect your face. So ask your loved ones, you know, do I look any different? Am I a bit puffy? Am I looking a bit bloated? You will notice you'll swell up around here. Now, you tend to have, as I said, a combination of these symptoms. The other thing that you will find when we test your wee is that we find protein in your wee. Okay, so what to do? If you have any of these symptoms and you're worried, telephone your triage. Most units now have a maternity triage. Telephone them and just have a little word about your symptoms. If you're going to see your community midwife in the morning, have a chat with her, tell her how you're feeling. She's going to test your wee, okay? What's going to happen when you telephone your triage? We'll ask you to come in so that we can check you over. We'll want to monitor baby. We may send you for a scan just to check the size of baby is okay. Now, sometimes you'll get these symptoms, you might get one or the other, and we'll test your urine. We'll also want to do some blood tests, and that can tell us whether you've got preeclampsia or not. And what we'll do then is decide whether we just need to give you some blood pressure medicine just to keep your blood pressure under control, and make sure that it doesn't extend further than that. Now, for a lot of women, that's all we need to do is monitor your blood pressure. We'll also make sure that you get regular scans to maintain a sort of a graph of the baby's growth, okay? So you'll see that you've got a growth chart you should have in your notes. Lots of places do, some may not. But we'll monitor the baby's growth and make sure baby does keep growing. With preeclampsia, what we tend not to do is let you go post dates. So the likelihood is that you'll be offered an induction at term. Remember, term in the UK is anywhere between 37 and 40 weeks. Now, if your symptoms worsen, then what we need to do is get you in, and if it's safe, we need to deliver baby. I don't want everyone rushing around and panicking, but this is your worst case scenario, okay? So that's what we're looking at. We will maintain your normal care as much as we can, hopefully at home with regular blood pressure checks and your medication. But if things worsen, then we'll look at bringing you in and keeping an eye on you in the unit, okay? Preeclampsia is a very well maintained condition, as I've said. It does affect the whole body, so that's why we monitor you very closely with the blood tests and checking your urine. Okay, but as I said, it's managed very, very well. Most women with preeclampsia do not go on to develop eclampsia, and they deliver quite happily and everything's fine. We'll keep an eye on your blood pressure afterwards as well, because postnatally it can still rise. In very rare conditions, about 1 to 2% of pregnancies, women will go on to develop something called eclampsia, and that can be quite dangerous, but we maintain your condition and hopefully prevent it becoming too serious by medication that we use. And what we're doing there is trying to prevent you having a fit. That is the worst possible outcome, very, very, very rare, and that's caused by the rise in the blood pressure. All right, so we're going to keep it simple. Do not be panicking. As I said, it's very rare, but again, it is managed extremely well. Here in the UK, we're very used to it. We know exactly what to do to make sure that you're okay and baby's okay. All right, a quick recap. Preeclampsia generally starts about 24, 25 weeks. It can start, very rarely, from 20 weeks pregnant or even 18 weeks. So if you have any of these symptoms, headache, frontal, not moving, taking paracetamol, drank lots and lots of water, it's not shifting. Visual disturbances, sparkly lights, okay, stuff that you're not used to, okay. Swelling, hands, feet, particularly the face. Epigastric pain, we call it. That's right at the top of your tummy, just in between your ribs. Okay, any of those symptoms, you're going to ring your maternity triage, give us a call and say to us, hey, this is happening, I'm a little bit worried. We'll invite you in, okay? Or if you're seeing your community midwife, see your community midwife and see what she has to say, get her to check your blood pressure. You will, as I've said, generally go on to have a normal pregnancy, maybe with a bit of additional medication and a bit more close monitoring of your blood pressure and baby's growth. And you will have a good outcome, so don't panic. Just be sensible. We'd rather err on the side of caution. So if you're concerned at all, you think you have any of these symptoms come in, the likelihood is that it's something completely unrelated. Remember that, okay? So that is preeclampsia.